Remember that over the years, the budget of the GHA and the care agency and ERS has grown exponentially. So I actually started digging out some figures this year, and the GHA budget has actually increased by 98% over the past 13 years. The budget of the care agency has actually increased by 119% over the last 13 years. So you start to get a feel very quickly of why it is that at this juncture we feel that it's important to start drilling down on those budgets. If you look at the GHA, the care agency and DRS together, it's a budget of £211 million, which is a huge spend. Therefore, I think it's very important to be able to pinpoint exactly where that money's going. Are we obtaining products from the cheapest supplier? Are we looking at how are we obtaining it? Are there ways that across a hospital, if you think about the hospital as a huge organisation with over 1,200 employees, with over 1,200 staff, are we doing things efficiently across departments? And sometimes you need someone to sit above it to look at what is going on from an organisational perspective rather than in the separate departments.
And what resources will the department have?
So I've been very pleased to welcome Terence Chichong, who started in late December, and there will be two other individuals that will be in the office with him to start off with. Mr. Chichong comes from an audit background himself. He used to work in the principal auditor's office, and he's very familiar with these processes.
What role does the patient play, if any, in the sort of audit process?
Everything is done with the patient in mind, but the patient themselves won't interact with the audit office.
Is it that you have some concerns and you need to address your concerns?
I come from a background where audits are something that happen as a matter of course. I think that this is a sensible step, given the size of the budgets that we're dealing with. You know, if you look at the budget, a budget of again 211 million for ERS, GHA, and the care agency. I think that it's something that needs to be looked at internally, so that it then goes to an external audit as well. But I think it's a very sensible step in the evolution of the GHA.